That was Mr. Jonah Francis from Pansy Home Care Services. It was great chatting with him. There's so much changing in the home care lineup. We're going to take a short break, and then we're going to be back with another guest. We're going to have Dr. David Bendor on, and we're going to chat a little bit about a lot of the questions that have been coming up to us in email about suicide. Why do people commit suicide, especially very successful people? So you're listening to Healthy Rounds. Our phone number's here, 860-522-9842. You're listening to Healthy Rounds on WTIC News Talk 1080. We're back on Healthy Rounds. I'm your host, Dr. Anthony Alessi, and it's great to have you back for the second half of our program. In this part of the program, my guest is Dr. David Bendor. Dr. Bendor is a psychologist. He's a doctor of psychology and in practice in West Hartford. And he's joining us. We want to talk a little bit about suicide and the so-called suicide contagion. David, welcome to the show.
Thank you for having me.
Let's get right into it. People are concerned a lot about, they're hearing more and more about suicide. And obviously, it's the famous suicides, the people who kind of have everything and are in the news. And when they commit suicide, it gets a lot more attention. But it's not just that situation. Can you talk a little bit in general about suicide?
Sure. I mean, and obviously, thank you again for having me. And, suicide is one of those hard things to talk about in the mental health field because obviously it's a tragic ending. It's an ending of life, a loss of life. And what makes it so tragic is that it's preventable death. It's not like, in your field, like an aneurysm that, we hear about, taking someone's life or cancer or something. I mean, this is by and large, these are preventable deaths and people are making choices to ending their lives. As you said, it does get a lot of attention in the news and people like me in this field and my colleagues, we become very concerned not only when it happens, but when it gets the attention that it does. And one of the primary reasons is what you already mentioned, is the so-called contagion effect.
Is there really a contagion effect?
There really is. And I say this not just from, the research and studies that I've read, but the patients that I work with, both in West Hartford, as you mentioned, and also at my other job at the Institute of Living at Hartford Hospital. You really become concerned when a suicide gets a lot of attention, either in the media or if it happens for school-age students and it gets a lot of attention in a school system. You become very concerned for those whom we would call an already vulnerable population. I'm less concerned for those who have no psychiatric history whatsoever, no symptoms of depression or other mood disorders. Folks like that will hear about it, say it's tragic, say it's sad, be saddened by it. By and large, those folks then rebound and move on and get back to their normal baseline. But for those vulnerable, either students in the schools or folks listening to what's being covered in the news, I absolutely believe in a contagion effect because it makes the possibility of committing suicide much more of a reality. As you could imagine, you could just imagine someone saying, wow, so-and-so in the news with all his wealth or so-and-so in the news with all her wealth did this. I guess it's an option now. It's now on the table.
Is it kind of a bimodal increase in the sense that we're seeing it in young people and older people?
Yeah, I mean, it's still one of the top causes of death in the adolescents and the young adults that I work with primarily, but it's also one of the highest causes of death in, interestingly, in middle-aged white males between the ages of mid-40s to mid-60s. It's also a top cause of death in that age bracket. It's actually on the increase.
So I guess we have to get to the question, why? In the sense of people are always asking themselves, why? Somebody who seems to have everything, money,
right,
fame, the things we put the most value on in society, why are they killing themselves? And so what's the answer?
Yeah, so obviously when we hear about these celebrities in the news, a person like me can't comment on that. I've never met them. I've never worked with them. Obviously, for privacy reasons, even if I had, I couldn't tell you on air. But the reality is, we don't know what's going on behind the scenes. We don't know what kind of psychiatric struggles were ongoing. We don't know what kind of substance abuse was ongoing, and those are the highest risk factors for suicide, depression and depressive symptoms being number one, and then when you add substance use, prescribed or not, legal or not, I'm not just talking about, but alcohol and prescription meds, when you add substances and intoxication, the probability, the likelihood, the risk for suicide skyrockets astronomically. More generally, not talking about the celebrities, but talking about that demographic I mentioned a few minutes ago, there's a study came out last year that got a lot of coverage where it talked about these deaths of despair. It was a very fascinating study, fascinating hypotheses. And the proposal was that, or the idea that was being put forth was that in an economy with declining job markets, and in an economy where things like divorce are on the rise, and marital discord is then also on the rise, that there's this population of white males, more often without college degrees, that are finding themselves more and more squeezed out of the job market, and they may be turning to substances, which, as I mentioned, elevates their risk for suicide. Their relationships, their study relationships may in turn be crumbling, and that also we know it puts them at much higher risk for suicide. Relationships is one of the highest protective factors, and it's always something I'm listening for when I'm evaluating someone who's suicidal.
It's interesting because someone had asked me that, and now that I've become older, I often, as we get older, we spend a lot more time reflecting on what we've accomplished and what we haven't accomplished in some cases. And I've always wondered if that despair over a perception that your life has not been full precipitates that. Would that fall into it?
Absolutely. I think it's one of those factors that's very well said. I think it's one of those factors that in of itself, by itself, it would not necessarily take the quote-unquote, psychologically healthy individual and cause him or her to become suicidal. But if you take that variable where someone looks back at life, and when they're at a certain stage of life and they're reflecting, and they're filled with more regret, and believe they made bad choices or didn't make, as much of themselves as they could, and you couple that with some of the other factors I described, I absolutely think that increases risk for depressive symptoms, depressive symptomatology, and then in turn suicidal behaviors.
One of the things you mentioned was you explored their relationships. In what respect do you explore the relationship? In terms of married or having a partner or socially? How do you explore that, and what are the kind of red flags in that category?
Yep, no, absolutely I do. I mean, and for all those things you mentioned, whether it's, a marriage, a committed relationship, friendships, those are all thought to be protective factors, with the thinking that you not only have more people around you who provide, regularly around you, who provide support, but those are also people that ideally one can turn to. And we know more often women are thought to do this than men, but we're hoping that with people around you, if one is struggling, he or she is more likely to talk to people with whom he or she already has established relationships. And if something is amiss, that person can reflect that back and say, hey, you know what, maybe you should talk to someone about that. And again, it's not a perfect protective factor, but it does increase the chance that someone might seek help, even at the urging of someone else, a friend or a loved one. Conversely, when I'm listening to parents or significant others, referring someone to me or saying, I have these concerns, if I'm hearing that, for example, a high schooler, a student, a college student, or really anyone of any age, has all of a sudden turned to isolating more, canceling plans last minute, not spending time with the friends that he or she typically spent time with, that's a big red flag for me. Not just for suicidality, but other mental health disorders. Isolation is a real risk factor. And I'll say often to folks in my practice that I can take the healthiest person on this earth and put them into an isolative lifestyle, and he or she will psychiatrically decompensate.
This is so interesting. We're going to take a short break, but I want to get back into some of these other factors that may be causing people and resulting in this increase in suicide. Actually, the phone number, I wanted to give Dr. Bendor's phone number so everybody has it. If you need to reach out to someone, if you need ongoing care, Dr. Bendor's number is 860-331-8649. He has an excellent website, and his last name is spelled Bendor, Dr. David Bendor. We're going to be back with Dr. Bendor and chat a little bit more about suicide, some of the signs and some of the things that are really precipitating factors to having someone commit suicide. You're listening to Healthy Rounds on WTIC News Talk 1080. We're back on Healthy Rounds. I'm your host, Dr. Anthony Alessi. We're entering our last segment here, and we're chatting with Dr. David Bendor. Dr. Bendor is a doctor of psychology, and we're talking about suicide. David, getting back to the topic, one of the things I read recently was sleep being a big factor in suicide, and particularly people with insomnia. Can you talk a little bit about that? Do you find that in your practice?
It's interesting. So that's a very important study that's going to need a lot more research. And I will find, so sleep is often a huge problem in psychiatric populations. And I'm going to pull back a little bit, not just in regards to suicide per se, but in some of the mental health disorders of which suicide are highly correlated. So, for example, depression, anxiety as well. When people aren't sleeping well, when I'm coming this, from a psychiatric perspective, their functioning decreases. There's no ifs, ands, or buts, and their problem-solving ability decreases. And as we all know, our threshold and our frustration tolerance also decreases. And so when a person has less of a capacity to problem solve and they're more exhausted, they're just drained, they're spent, it absolutely can lead to an increase of depressive symptomatology, which then in turn can lead, especially for an already vulnerable individual, can lead to spike in suicidal ideation and behaviors. So I'm really glad you brought that up, because often when I work with, both in my outpatient practice and then with often a more acute population at Hartford Hospital, we're always addressing sleep as readily as we can, because it has such a kind of an umbrella effect, if you will.
Yeah, this has been a big problem in my practice because I treat athletes, many of them professional athletes, and their schedules are so erratic that it's very hard to get into a regular sleep schedule. So you'd be surprised how many professional athletes and performers have a lot of difficulty with sleep. Sometimes it really hits the press. Michael Jackson being most famous. Again, he was using propofol to try and get some sleep. That's how desperate people become, that he's willing to go under general anesthesia just to get some sleep. So it really makes people more desperate overall. One of the other things I guess I wanted to touch base with you is religion, in the sense of, has religion played a role in suicide, from the standpoint that there are many taboos in the Catholic Church and in other Christian churches? The belief is that you won't get to heaven if you commit suicide. Obviously, we have radicals out there who think that committing suicide does get them to heaven, in terms of these bombers and people of that nature. Can you address how religion might play a role, if it does, in suicide?
Yeah, and I'm going to talk, again, like you're saying, more commonly what we know of, more the general population. And again, another great question, because when I sit with someone who's depressed and I want to, or potentially depressed, potentially suicidal, and I'm asking about risk factors, absolutely. I and all my colleagues are asking about risk factors. But we're also asking about protective factors, such as, and it's very simple, what are some of the reasons that you haven't committed suicide? Or if you've thought about it, that it hasn't become a plan. If it's become a plan, why you haven't followed through. And we call these protective factors. And I mentioned some of them before in terms of relationships and friendships. Pets is actually a very popular one. But religion and religious beliefs often are as well. And you are absolutely right. There are folks I have met with, and they'll say, and they'll come across and present my office or at the hospital, very desperate, very dire straits. And I'll ask them, what have you thought about suicide? Let's talk about, to what degree you've considered suicide. And some of them will sit right upright in their seat and say, oh, no, as bad as it is, I will never do that. And they will cite religious beliefs as a protective factor.
So obviously it is a protective factor, which is tremendous to know. I guess sometimes when you query a patient or anybody, and people shouldn't think you have to be a professional, one of the things that we emphasize really is If you think someone's thinking of suicide, ask them, and just come right out and ask them. But one of the challenges I've had in the past, and I don't know if it's a challenge now, I haven't had it recently, is I ask people if they have weapons in their home, if they're thinking of committing suicide. And if they do, I guess the first thought is get the weapons out of the home. Are we able to do that now in Connecticut?
I wish that's a great question. I honestly am not sure about that. I know I've been following other states and some of the states, I think maybe it was Florida and some other states in terms of what's being allowed. So that's something that, we can definitely look up once, we're off the air. But I will say that I want to say actually two things, because you mentioned what you do in your own practice, or even you might do this with, a friend or family member, not in your professional capacity.
Yes.
We know now, and the research backs this up, asking someone if they've thought about suicide does not introduce the idea of suicide. You won't take a person who's never thought about it in their lives, ask them about it once, and all of a sudden they're going to leave your office dwelling on it and ruminating. It doesn't work that way. So you are correct. Whether it is perfectly okay and appropriate and in certain settings expected to ask them if they've considered it. When it does come to weapons, especially if there's anything, then yes, we do look, and again, in cases like that, if I can't necessarily go a legal route, I'm definitely engaging the family and loved ones of the person I'm interviewing and saying, get these weapons out of the house, get them to, another destination where they're locked up, et cetera, et cetera. Absolutely, because what you're trying to do, and and I'll do the same with other legal means, such as prescription medications and things like that, depending on what the troubled person's thoughts are. I want to get the means to commit suicide as far away from them as possible. So if they have the urge, and this is, realistically speaking, because if the person has the urge, what my hope is that we can have interventions that make those means further and less attainable and literally frustrate the urge, the thinking being that by the time they might travel somewhere that they might be able to do something, perhaps the urge to commit suicide has lessened, and there have been opportunities for other interventions to take hold.
And actually, in all the cases I've had, I've usually been able to get in touch with a family member who has gone and taken the weapons from the home. I guess my next question on this one is, the next question we're always taught to ask a patient is not only have you thought of suicide, but have you thought of how you want to commit suicide, and see if they actually have a plan. Again, is this important for a family member to ask someone? I mean, we've always been taught this in a professional capacity, but I'd like the public to know, if you have someone who says, yes, I've thought of committing suicide, should they go and ask that next question?
Right. And, it does depend on the relationship the person has, right? So if this is, out to dinner with a couple that you're just meeting for the first time.
Yeah, I would think no. Yeah. Okay.
Those kinds, right? But, and again, I'm exaggerating there, but it really does depend on the relationship and the kind of discussions that you've had with the person. But absolutely, especially if the person is striking you as really distraught, and that doesn't take a PhD or an MD to kind of discern. If a person strikes you as very distraught or tearful, or their behaviors have just shifted. I mentioned the isolation, or they're posting some very bizarre, troubling things online, just real dramatic shifts of behavior coupled with a troubling presentation like right in front of you. It is very appropriate to ask if they're ever having those thoughts. It's appropriate if they answer readily to even ask, if they've thought about how to do it, especially if you have a chance to intervene right there. Like, I've had a person who was having fantasies of doing it later that day, and they named the bridge. I had just met them in my office for the very first time. And again, I know that's more of a professional setting, but it doesn't hurt to ask. And the important thing is that, as you said, we're first querying if they've ever thought about it, and that if they say yes, that's a risk factor. If they get to the point where they're actually making plans, that's an even graver risk factor. And also then we would ask if they have thoughts of following through with those plans. Those three things: the ideation, the intent, and the plan. That puts the person at the highest risk factor.
Do the suicide hotlines help? I mean, and I want to repeat that number so everybody you can't repeat it enough. We've seen it all over. The 1-800-273-8255. Do those numbers help?
They do, and I say that unequivocally because I've spoken to people who have used them. I met with a young man earlier this week, and I not only gave him that number, I gave him, as I mentioned, I'm over at Hartford Hospital, so I gave him our 24-hour assessment number hotline, and and obviously let them know about 911 and and giving a person that option that they know they can speak to a trained professional, an actual person, and that they don't have to just be left with their thoughts at the end of their workday, or if they're home alone by themselves till they go into their job or school the next morning. Knowing that there's someone out there definitely makes a difference for a lot of people.
David, I wanted to thank you very much for your time today. We're coming up on the end. I know we have a call, but I'm going to take that off the air. So, but I just wanted people to understand that there is help for suicide, and I want to thank you for all the work you do. I want to give your phone number out again at 860-331-8649. That's Dr. David Bendor. He's in West Hartford. David, thank you.
Thank you very much.
That was just great to be able to chat with him a little bit, and especially about this. I should personally let people know I did get to meet Anthony Bourdain one time in an airport. We were in Haiti, kind of stranded there, and he just impressed me as just a regular guy. Everything you hear about somebody like that, sitting with his crew, entertaining people, taking pictures with folks, it was just amazing and just sad loss. Many thanks to our studio producer today. Joe Acosta has been on the board sitting in for Mike. Jeff Chandler's in charge of sales and marketing for Healthy Rounds. And next week, we're going to be chatting with Dr. Nia Mae Wilson about breast cancer. Next up on WTIC is Garden Talk with Len. Until next week, please stay healthy.
This has been Healthy Rounds with Dr. Anthony Alessi, sponsored by St. Francis Hospital and Medical Center, Ratchford Eye Center, Covaris, and the Connecticut State Medical Society. Be sure to tune in next Saturday morning at 11 for more Healthy Rounds on WTIC, News Talk 1080, and WTIC.com.
What a matchup!
And what a team, Mike. Metro PCS and the iPhone SE for $0 on a network that covers 99% of people in the U.S. Oh, impressive.
Play with the best. Switch to Metro PCS and get a 32-gig iPhone SE for $0. Metro PCS. Coverage not available in some areas, plus sales tax and $10 activation fee. Claim based on talk and text. Not valid for active numbers currently on the T-Mobile network or active on Metro PCS in the past 90 days. See store for details and terms and conditions.